My name's Phil, and I have aphasia. But my goal is to talk about other people's stories too. Remember, it's your voice. There's no way around it. The only way to get better is to practice. Now, you don't have to be like me, but you need to be able to talk and listen to other people's stories too. Like this one right here.
Yeah, I'm Kacey Keyser, and I'm a speech language pathologist currently working with the adult population.
So, first of all, thank you so much, all of you guys.
Yeah.
I don't, I mean, it was being there, really, my phone goes off. Because of the fact that if that wasn't an station there, a place to live with everybody else, I wouldn't have made it there. I mean, first thing I want to know, I say rehab now. I can say the word rehab before.
Yes.
As
I
a rehab,
remember when we were on the phone, you were rehabilitation was
yeah,
that was a hard
rehabilitation.
one.
And it was funny because I was like, I knew the place it is, but I'm going there. And I thank you for all the apps.
No problem. I'm
Um,
glad that you still use them. They
oh
were
yeah,
really
all the
helpful for
time.
you when you were there, and I'm glad they're still helpful.
Yeah. The fun thing is, first of all, I'm gonna get this question. Speech teacher, I'd say speech pathologist, but I say it wrong all the time. Speech
Mhm.
teacher need them. I don't understand how anyone think because I do a lot of meetings with other people, and I'm very vocal, as you probably know.
Yeah.
And I'll tell people, listen, if you don't have a speech teacher, then you'll never get better. You can't. There's no way around it. No magic pill. No. There's nothing, and I don't understand how you do that.
Yeah, I'm glad you feel that way. I'm glad you feel that I was important. And I think that everybody heals differently from
Yes.
different ailments and stuff, and everybody has a different like journey as far as especially stroke recovery goes. And there is a such thing as spontaneous recovery. So like as the brain heals, there's spontaneous recovery, but our job is to make that recovery better and quicker and education like educate our clients. So like the apps that I gave you, the tricks that I tips and tricks I gave you and your mom, that's all stuff that people wouldn't be able to do on their own. So I'm glad you feel that I was helpful. That's the purpose. That's
Yeah.
great.
I mean, I don't think anyone that I would go this far so quickly.
Yeah, I mean it's been how when was your stroke? You
Two,
were I just looked
3 years
back.
ago. 3 years.
Okay, it was like October of 2022 or
Y-
like just before like the summer of
Yeah.
2022 and
Yep.
you came to us in October. Okay. Yeah.
I was then there till
February.
so thing I find out dates and numbers are not good for me right now. I'm getting better at that.
Hmm. Hmm.
I'll look at
Yeah.
the calendar and usually find out the dates, but
Mhm.
yeah, there's yeah the thing for me the fact it was a sanctuary. I mean, even though most of you had other stuff to do because the money my money didn't get there, but the fact that everyone said um Trish, Chris, and Jay,
Mhm.
they all there. Listen, you have a second, go to the hall and do this stuff. It was cool. Like,
Yep.
um, and it was good. I, I know that it was there to help me with doing better. So I wasn't not gonna not do anything. I,
Right.
and first of all, I love the fact that I can go to your microwave.
Yes. Yes, you and your mom, you had open access to the microwave.
Yeah,
But like you were saying, like you could come down to the gym whenever you wanted, It
yeah,
was like you could come down and we were like a getaway for you, because it's things got crazy out there and like we wanted you to have some place to just come even if you were just hanging out, like if we were in there, like you could be in there hanging out doing like your stuff on the tablet, and I think that that was like a really good like relationship that we had with you while you were there.
Yes, and it was cool because first of all, can I ask you a question?
Yeah.
What was I like?
Well, when you first got there, and it's funny that you said you're having trouble with like the dates and like numbers and
Even
stuff
better
because
that.
yes, but that was something I remember was very difficult for you then too.
Hmm.
But when you first got there, you could like there was no you were trying to communicate, but as far as like expressive language goes, that was very challenging for you. And I don't it took us a while to get like meaningful words from you and like especially like a string of sentences or like even just a sentence that was very difficult, so it was hard for you to understand or to understand you and receptively too, like you were having trouble. That was I do remember that receptively that was better, you were better at understanding. It was easier to get a message across to you than it was for you to communicate yourself, which is helpful that receptively that was a little bit better than you could communicate and you could speak, because it was easier to like train you and like improve your language expressively. But I mean, it was very challenging in the beginning.
Yeah,
Not that you were a difficult person at all. You were great to work with, like seriously excellent. Like you, because you were so motivated, because you were like, I want to get better and I want to get the heck out of here.
yeah.
Um, and your mom was such a great advocate for you too. So you had like a lot of really great things going for you. So you were a great patient, a great client to have. But like your stroke was that was a doozy. It was a pretty significant one. Yeah, I know. Yeah, your skull got put back in. I
Yeah.
know. And you had to wear that. You had the like the helmet, the soft
helmet,
helmet.
helmet to put it up right here. Do
Yep.
you know something about that? Before I came to you guys, Westgate and Bryn Mawr, one of
Hmm.
the guys like, he's like, the helmet real big like this. He's like, come here a second, and cut it off. He's like, I can do this the whole time, and it's the helmet. It's a
Oh,
little
it was
like
in
this
your
now.
eyes.
Yeah, it's like
Oh
this
my
now. It's like,
god.
I said, why'd you tell me the whole time? I said, there you go. Do you remember the time that I was talking about? I forgot his name. The fact that the one time I was there, and this they'll edit this out, but it was funny the time that you guys are downstairs, and I was telling the guy ate on my food,
Yes.
and you
Yes.
guys is like that happened all the time. It's like what? And they're like 1 minute in, 1 minute out. Oh, we're like what is?
I do remember that. Yes.
The thing I thank you because like I said before, I would never ever made it that far. Both of the places I've been there, I've been lucky. There have been people who help. Like everyone want to help, much they could.
Hmm.
You know,
And I think it was easy to help because you were so motivated. Like you were receptive to all of the help. Like you listened to everything that everybody was telling you, like PTOT speech, like you were really taking into account like everything that we were saying, and it was really easy to educate you, and like that's why your recovery went as well as it did because you were motivated.
thank you. I just not. I just, I didn't know what it was. First of all, I didn't even know what aphasia was.
Mhm.
I still didn't know what aphasia was until why back to Dayton, Ohio, and they know the word was. I didn't know the word was or anything. I just know I want to get better. I didn't know that there was called aphasia. First of all, I can't even say aphasia, and I'm sure everybody else aphasia like I don't know what you're talking about, but the fact is that again, I can say the physical training and the OT they're good too, but
Mhm.
if you don't have a speech teacher, you just can't. And I just I wouldn't be good as was now, and I'm getting better. And this I have my own space now for YouTube,
Yeah.
and it's just like my goal now is I understand like I'm lucky because you gave me some apps and other apps, and I know all this stuff for other people, and I'm saying it's fun. The one thing that sucks is that people that have don't have money. It
Yeah.
sucks,
Mm-hmm.
And also the fact that I'm looking at this now, like, now that I'm getting better, it's my job now, my passion to help other people with aphasia. Because I look at it now that they're just people with something happen to them.
Mm-hmm.
And for people with aphasia, kids with aphasia, we're just people with having something happen to them. And that's my goal, whether you want to or not. I'm going to talk about aphasia. You have no choice. Because
Yeah.
as you know, I'll talk to you. And if you don't listen, well, that's your
I'm gonna
fault.
keep talking anyway.
Yeah. And guess
No,
what?
but I think it's so great because it's like such a bonding experience. And like a lot of like I used to work at I did an externship at a hospital in Maryland, and then I worked there for about a year, just like on the weekends. But they had an aphasia support group. And so like every, I don't know if it was like once a week or once a month, whatever it was, like they would, everybody in the community who, whether they were, had been at that hospital or not, like, or whether they were seeing speech therapy as outpatients at that hospital, like they would come together, and they would be like a support group, and they'd talk about like, oh, like this happened to me, that happened to me, and like just kind of like sharing your experience. Because like you said, like I, people know that strokes are a thing, right? People don't always know that like what the outcomes of strokes are as far as like language, and people don't even know what speech pathologists are until they need one, unless they're in the medical field or they've studied it. So that you're, case in point, like you're a perfect example of that. So I think it's really great that, like, honestly, all of us, like everybody says hi at Westgate: Trish, Cassie,
On
Jay,
this,
Sarah,
I can use
Clint.
two of my hands now.
Yes. Oh my God, Cassie will be so excited.
Tell her. Thank
I
you,
will.
everybody. Like I remember I do like this the whole time, and I said no.
Mhm.
I I wish
They're
people
so proud of you.
I wish people understand. You need OT, PT, all this stuff together to do better rehab. Like
Yeah.
like my goal has always been this because I was an athlete. I was saying if I can do this, that's my goal. So it was never like well, I want to do just a little bit. I know. Now it'll take time, and it's funny now that I've gotten better. I realize how far I have to go,
Well,
but
of course.
it's
Yeah. There's
okay
always,
now. But it's okay
yeah.
now. Now it's saying, oh, this is going to be harder than I thought. Okay, well I know that I don't care anymore. But it's. Thank you so much, guys. All you.
Yeah, but everyone says hi. Everyone gives you their well wishes. I was like, I've been updating them. Like the one day you called me and Trish and I were on the phone, and so like every time you send me an email or like I see an update from like your Instagram or on your YouTube
Cool.
page, like I update everybody, and they're all like so excited for you. Like it's such a cool success story for like all of us to have, and to see like you and your mom, and just like the great like relationship and like lives you guys have now. Like it's really just great, and it makes everything worthwhile, that we do, and every minute spent like helping you and helping, people like you, like it's worth it.
Thank you so much. And I know I have so much to do, but I have to give my flowers to everyone who helped me along the way. Because how do you deal with people who just don't want to do anything? Is it that you just can't do anything about it?
Yeah, I mean, therapy only works if the patient buys in.
Thank you.
If they, right, if they
You
want
understand
the
that?
help, of course,
No,
yeah, if they
I
want the
want people to
help,
understand that. Like
yeah.
when they're doing stuff for other people, listen. If you don't talk and get better, you can't do anything about it. And I hate to say it sometimes. These people just aren't won't be able to help because they don't want to do anything. And just I'm said, and it's funny in my other speech sessions or Zoom meetings. I'm the one who said you wouldn't know what's really going on. And other people use it like this. My name's Phil, and I have aphasia. Blah blah. Like no. Look, we all have aphasia. You want to know what's really going on. And sometimes I tell them, like, listen, if you don't try, you won't get better.
Yeah,
And they said,
it's
like, no,
true.
okay, you're wrong. But going to a speech teacher for one day a week, there's no way. You can't just be like, I'm there one hour a week, and that's it. The rest of the day, like, you can't do anything better.
It's tough. And like especially in the very beginning of your like recovery, like acutely after a stroke, like those first like couple weeks, like they make or break, you know. If you wait months before you start therapy, then you know you've already lost so much muscle in your arm, your leg, like, you know, everything kind of like stays the way it was. Like the sooner you get into therapy, like same with language, like your recovery, your outcome, your prognosis, that will all be better the sooner you get in. And like I said, buy in is everything. Like, we're not doing therapy to you, we're doing therapy with you. Like, if the patient isn't participating, then nothing's going to happen. You know, I've had a couple patients where I'm like, listen, this isn't my life. This is your life. I'm trying to help you. I mean, I was like, I can't force you to do anything you don't want to do. And this isn't for me. This is all for you, you know? So, yeah, it's true. Like if you don't want to get better, you won't. And if you do and you really try, and you know, a lot of times like having a very strong support system like your mom, for
Yes,
example, like, you know, that is huge. Like if you have nobody, then it's harder, you know. It's
it's
still
true.
it's still possible, you know, obviously if the person is motivated enough, but it really, really helps if they have like a good, strong support system of some sort.
Yours is true because my friends are still my friends from the beginning.
Yeah.
And they
Yeah.
said that one of my Zoom meetings, I said, listen, my bad. I said, I don't know how it was talking before when I had a stroke, but I don't know, I don't talk fast as I did before now. I said, I'm blah, 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 blah. And I said, listen, my bad. I didn't know what I was saying to you, but I'm sorry. I've never talked that fast ever again, ever again. The fact is, it's funny. Some of my friends are like saying like, it's funny you talk clearer now than you did before. Like, I know.
No way, really.
Yeah, that's how
You're
fast
a
I
really
was.
fast talker. Oh my
Oh,
gosh.
really fast. And
Well, hey, this kind of puts things into perspective for you. It
yeah,
makes you slow down and kind of makes you
I have no
like
choice.
take your time. You don't have a choice.
I mean,
So it kind of forces
all my
it.
friends I talk to now, I've had friends in there since fourth grade, and saying,
Yeah.
no, I was like, really, yeah, man. They're like, trust me, if I have videos, trust me, you're really fast. I'm like, my bad. And thank you so much.
Yeah.
And you guys were so fun. I mean, I didn't have fun doing music because I was gonna have fun either way. But it was cool to have people to talk to and listen, even if just for a second,
Yeah.
because I don't. The other place, the rehab place, is nice. That's all I'll say about that.
Yes. And I think too, like it really helps because we had all personalities that really meshed together, and like you were like a great addition. Like you were a client, but also like you were like a friend, you know, like we could talk to you, like you could talk to us, like we had like a great like rapport. And I feel like like in a department itself, like the PT's OT speech, like the director, like we are such like a great group of friends like in the rehab department. So like we make therapy fun, and I feel like it kind of overflows onto our clients. Like they want to come to therapy with us, like they want to be in the gym and be around us because like we're honestly, like, not to brag, but we're a fun group of people, you know, and like
Most people
we're like,
are.
yeah, yeah. And like we, you know, so I feel like I appreciate that you enjoyed being with us because, you know, we enjoyed being with you too. And it's nice when like a team is like collaborative and like they all work together, you know, all the different disciplines, you know, because that just makes everything one easier and two more fun. You know, as far as like just day-to-day life, like when you go to work and you enjoy it, like it's gonna show off onto your patients too. Like as a team, like if you're enjoying what you do, your patients will understand that, like they'll see that, and like it'll be better outcomes for them, like being in like a nice work environment.
So cool. I mean, I've got lucky because I've on my lot of Zoom meetings. There's people that say they're mean. I'm like, that sucks. That has the people who sucks get another therapist. Yeah, another therapist because. But a lot of times, I think people just give up sometimes,
Yeah,
and it
if
sucks.
yeah, if they're not having a good like therapy like interaction, and not every therapist is going to get along with every patient. There's different personalities, difference
Yes.
in like all that kind of stuff. So like, yeah, I mean, like it's just like a therapist for like psychology. Like if you go to talk to a therapist like in psychology, and you maybe not on the same page, or like you just don't get a good vibe, then like you go find another therapist.
Yeah.
So the same thing can go for PCOT and speech. If you're not vibing, or if you're having a good experience with your speech therapist, then maybe like look for another speech therapist, like, because you have to have that good rapport. And it has to be like, the client is enjoying their time too. It's not all like, most of it, yeah, if you have somebody that's like knowledgeable, like you'll get a good outcome,
Yeah.
but the other half of it is having like a good relationship with your therapist.
I need to tell you something. I think I
Yeah.
know I've said in my episodes the fact that when I was first there, no one, people didn't really talk to me a lot, and it was B. She's not there anymore. B.
Yes.
People. They said you can talk. Yeah, I can talk. They thought I was mute.
I think people are scared of aphasia because they don't understand it. I think it makes them nervous,
Well,
and
I didn't.
because they just don't know how to interact.
Well, some of the people also just are mean. There's some people.
Yeah.
There's some people who are just mean. Like
Yeah.
I really feel that sometimes just don't want to talk to you for any reason, and I've found out it's because something happened in their life. It has nothing to do with me.
No, no.
And
And I think too, like, you wonder why some people are in those certain professions that they're in if they don't enjoy being with people and patient care. So, I mean, that has nothing to do with you. It sounds like a personal problem.
yeah, the program. Now remember, subscribe, please.